Hello, I'm going to be demonstrating Foley insertion. The first thing you always want to do is knock on your patient's door, walk into your patient's room, explain to your patient who you are and what you're going to be doing, tell them the procedure, ask them if they have any questions, verify their name and date of birth, make sure you wash your hands, provide privacy, put the bed up to working height, put the rails down, and when inserting Foleys, it's very important that you ask your patient if they have any allergies to latex or iodine or shellfish. Make sure you have your supplies with you. So I have 4 washcloths, and then I have a towel or a chuck, and I have my Foley insertion tray. I have a basin with soap and water and a basin with just water. And after you've done all that, now I will put on my gloves. Now that I have my gloves on, I'm going to pull my patient's sheets down. And if my patient is able to lift up their bottom, then I would just be able to put the chuck pad underneath or the towel. But if not, I will assist them to roll. So to help someone roll, you always want to bend this leg and help them roll on the count of 3. And straighten that leg. The other side, lift up your leg, roll over. Finished. And I'm going to pull this up to expose the area so I can get it clean before I get started. So it's butterfly position, but for the sake of the video, I'm going to straighten this leg out so you can see. So now I'm going to take my first washcloth. I dipped it in soap and water. I'm going to use this hand to hold this open, and then I'm going to clean one side, top to bottom or front to back. Use a different part of the washcloth, clean the other side, top to bottom or front to back, same thing. And then use a different part of the washcloth and right down the middle, top to bottom. And then I'll put that in my dirty hamper. And then the next one is just water. And I'm going to do one side, top to bottom, use a different part of the washcloth, the other side, top to bottom, use a different part of the washcloth, top to bottom. Okay, now you're finished with that part. Now you're gonna take off your gloves, wash your hands, perform hand hygiene. Okay, now I'm going to open my sterile kit. So you open it from the paper side. Pull it out. That in the trash. Take this off, put it in the trash. Now it has a flap. Some of them, the flap is on the bottom, so you just pull it off. So I want to open it away from me without going over my sterile field. Now everything in there is sterile, so you can only touch the edges. Now I recommend that you push it back, pull it back, so that only the tip is here. Because when it's all the way like this, you can touch it or you can lean over it and you're leaning all on your sterile field. Just a little space between you so you don't accidentally touch it, and then you work like this. So now you can take this first one, open it from the tip. You can either set this aside, just toss it aside, but if you want to put it on your patient, see, I'm holding it from just only the tips, and then I'm going to come over here and drop it on my patient. I'm not putting my hands down there or touching anything. I just dropped it. Next thing on the top here is my sterile gloves. So I'm going to grab them. It's best if you move your gloves to the side so you're not disturbing your sterile fill. You can do it over there, but it's risky that you can contaminate. So when I open them, I like to fold back the edges, because when you fold it back, it helps it stay in place. Now the first one, you're going to grab from the outer cuff and just slide it on. And the second one, you're going to grab from the inner cuff and then you can slide that on. Now I'll just move that out my way so I'm not tempted to be outside my sterile field. You can touch your gloves, you can fix your gloves as long as you stay here in your sterile field. Okay, back over here, what's on top? You can take this one, you can touch it because you have on your sterile gloves. And again, I'm just going to twist sideways and drop it. When you drop it there, you don't fix it or put it where you want it, and you just let it go. Okay, so I'm coming back. I don't need this. I don't need this. This is the cap. And I'm moving like this so that I don't go out of my sterile field. Okay, these are to clean the patient, so I'm going to open these. And I like to open it low enough where they're sticking out so they're easy to grab when I need them. And then I'm going to open my lube. And I'm going to open my saline. Okay, so now I have my catheter. So I'm going to pull it out, but making sure I hold on to the tip as I pull it out so it doesn't fling anywhere. And now I'm taking my catheter and I'm just going to dip it into my lube pack. And I'm going to set that back in there. And now I'm taking my saline and my cleaner, set that aside. I'm going to take my saline and connect it to the port so it's ready to go. And now everything is in my box and it's sterile. So I'm going to twist sideways and I'm going to set it right down in the middle. Okay, so now I'm going to take this hand and hold it open so this hand is no longer sterile. So I'm going to grab one and clean one side top to bottom, pull it out and drop it right here. Go back in, grab another one, clean the other side top to bottom, pull out, drop it right here. Get the last one, clean top to bottom in the middle, pull out and drop it right here. Now you can't drop it here because you're crossing your sterile field. So you have to top to bottom and pull it out here. Okay, so now I don't need this anymore. I'm going to grab my catheter, remove it from the loop. I just slid it off with my finger. Find the spot, make sure the catheter doesn't touch the leg or your arm. Find the spot and slide it in until you see urine. Once you see urine, then you're going to push it in one more time to make sure that it's all the way in the bladder. And then you can hold it and with this hand, push it in. And this is a 10 cc balloon, but make sure you know if yours is 10 or 5 or 20, and then remove it right away. If you don't remove it, the balloon pressure is going to push it back out and this is gonna refill. So after that, you're finished with your sterile fill. So I'm going to take this off, set it there for a second, clean up this mess. I'm going to take my washcloth and I'm going to clean the iodine off my patient because it can cause like itching and skin irritation. Same, right, left, down the middle, and then use another one to pat it dry. And I will connect this to the stat lock. And then I'm going to hang this down on a non-movable part of the bed. You cannot hang it on the rails. It has to be on a non-movable part of the bed. After that, you're going to ask your patient how they feel, how they tolerated it. Educate your patient to call you if they have any itching, burning, or pain. Put the bed back in low position. Give the patient the call light. Make sure they are sitting up to their comfort level. Cover them back up. And to take off your gloves, wash your hands, open the privacy door. After that, you're going to go document the time, the date, what French Foley you put in, how many cc's you put in the balloon, how the patient tolerated it, that you educated the patient, and the color, the amount of the urine, if there was an odor or not. That's Foley insertion. Bye.